So just because your results came back listing you as predisposed to type 2 diabetes, it doesn't mean that you're necessarily at a high risk for developing the disease. The genetics of type 2 diabetes is complex, and it doesn't rely on only one genetic marker to guarantee that you'll be affected. The factors that put you at a much greater risk for type 2 diabetes are things like obesity, your diet, how much you exercise, smoking, and your sleep. With obesity, your risk of type 2 diabetes rises as excess body fat increases. So, keeping your weight at a healthy level is really important. Your diet can obviously affect your weight, so maintaining a healthy diet is crucial. But there are other ways that you can impact your risk of type 2 diabetes with your diet. If you decrease the amount of saturated fats, which are the animal fats, sugar-based drinks, and alcohol that you consume, your risk for type 2 diabetes dramatically decreases, as well as increasing your fiber and magnesium and zinc rich foods that you eat. And remembering that whole grains are better, meaning choose wheat bread instead of white bread and brown rice instead of white rice. Things like that can make a difference. The bottom line to healthy eating is to eat real, natural, and unprocessed foods, and that can help reduce your risk for type 2 diabetes later in life. Exercise is obviously important to your weight as well, but studies even show that intense exercise helps to reduce your risk of type 2 diabetes. So the more often you exercise and the higher the intensity of your exercise, the better it is for you. Smoking can increase your chances of type 2 diabetes as well. So you'd want to avoid that. But also, you have to remember that secondhand smoke is damaging too. So staying away from secondhand smoke can help reduce your risk of type 2 diabetes. Sleep is really important. Getting too much sleep and getting too little sleep are both detrimental in whether you develop type 2 diabetes or not. So you want to make sure that you're getting around 6 to 8 hours of sleep a night. But then you also have to remember the quality of your sleep is important too. And poor quality sleep can lead to type 2 diabetes as well. The bottom line is you have more say in this than your genetics do. If you live a healthy lifestyle and are conscientious of those things that I discussed above, then your chances of ever developing type 2 diabetes is likely very low.